Hi, my name is Andrea Murad. I am a genetic counselor in the Cancer Genetics Clinic at the University of Michigan. I am going to talk with you today about collecting a family health history. So I have no financial conflicts of interest to disclose. So starting out, gathering a family health history that is accurate is an important part of the medical intake process. As we all know, this process can sometimes be very lengthy depending on the size of an individual's family. How many of those individuals in the family are affected with different health conditions that somebody might report can also impact how long it might take during the intake process. But on top of that, it is always something that we encounter that many individuals may not have a lot of information about the health history of their relatives. However, at the end of the day, it is still very important to try and elicit as much information from patients as possible about the health history of their blood relatives. So the family health history includes gathering and documenting medical and other health information, not just about the patient or the individual that you are seeing, but also about their blood relatives. Typically, when we talk about their blood relatives, we're going to be referring to all of their first, second, and third degree relatives. The reason that gathering this information is important to a medical evaluation is that information about an individual's family history can identify whether or not there are specific conditions that are seen in the family more frequently than what we would be expected just given chance, and whether or not there may be conditions that might run in the family. The other thing that is useful when gathering the family health history is that it can help us to identify other individuals in the family who are currently unaffected with those conditions that are being reported, but might be at an increased risk of developing those conditions. In a genetics evaluation or genetics clinic visit, we take an extremely detailed family health history and put this into a visual format that's called a pedigree that is shown here. I'm sure you are all quite familiar with what a pedigree is, but just to give you a little bit of orientation to reading a pedigree, on pedigrees, individuals who are assigned male at birth are shown with a square. Individuals who are assigned female at birth are shown with a circle, and individuals who are non-binary or gender is unknown are shown with a diamond. In this particular pedigree that's shown here, there are quite a few other relationships that are shown. So shown down here, the individual with a P in the center of the diamond shows a current pregnancy. Over here on the right, you see fraternal twin sisters shown over here with the two females that are connected by diagonal lines leading up to the descending line. You see an individual who is adopted, which is shown by using a dashed descendant line instead of a solid descendant line. Some other relationships that you might not see, or other things you might not see indicated on a pedigree, but that are not shown here, are individuals whose current gender identity is different than their sex assigned at birth. This would be shown on a pedigree using their appropriate symbol for their current gender identity, then using a specific acronym to indicate their sex assigned at birth underneath the symbol. So for example, a transgender male would be shown with a square symbol and the acronym AFAB, which stands for assigned female at birth, underneath that square. Additionally, in this pedigree, you can see that anybody who is deceased is shown with a diagonal line going straight through the symbol. So what information is important for you all to be collecting? It is certainly not expected that clinics outside of genetics clinic gather as detailed of a family history as we do, nor that they are generating pedigrees. But it is still important to collect family health history that is pertinent to understanding what, if any, conditions are running in a particular individual's family. It is important to ask about what side of an individual's family the person is related on. So indicating both maternal and paternal relatives. Sometimes people think that one side of the family might be more important than other sides of the family, but really we want to know about cancers on both sides of the family, not just one or the other. Always trying to get individuals, family members' ages, whether it's their current age that they're at, the age that they passed away at, or age of diagnosis of cancer is really important. Oftentimes people don't have these exact ages, and sometimes I found that it helps to kind of relieve the stress of trying to get them to come up with an exact age if you ask them for an estimate. So any idea approximately what age somebody was diagnosed or what decade of life they might have been in when they passed away. When gathering a family history of cancer, it is important to get family history of cancer for all first, second, and third degree relatives, as previously mentioned. This would include parents, siblings, children, grandchildren, grandparents, aunts, uncles, and first cousins. And making tight note of all types of cancer or where the cancer originated. So it is certainly important to ask about, some of the more common cancers like colon, breast, but it is also important to ask about any type of cancer in the family, even if they're more rare cancers. The other thing we always like to make note of is that it is important to ask about not just cancers that are specific to the area where you might practice in. So, for example, if you're a gastroenterologist, it is important not only to note family history of colorectal or other GI cancers, but also a family history of breast or ovarian or uterine or thyroid or any other types of cancers, as these could be related cancers in terms of the different hereditary cancer syndromes that we see or different genes that we know to be associated with inherited cancer risks. When documenting the family health history, it's also equally important to be clear on what the cancers were in the family. Documenting that there is just cancer in the family is not entirely helpful. If people have given you the type of cancer, say prostate or breast cancer, it's much more useful to document the type of cancer. As I previously stated, it is important to note what side of the family a relative is from. So indicating paternal aunt is much more helpful than just aunt. Same with maternal grandmother being much more helpful than grandmother. The other thing that's important when documenting a family history is trying to be more specific about the individuals you're referring to. So if there are multiple individuals with the same relationship to your patient that have had cancer, being pretty specific about who you're referring for. So if a patient has 3 sisters and you list sister with breast cancer, sister with ovarian cancer, sister with colon cancer, this is unclear as to whether this is all the same sister with all of these cancers. Each of her 3 sisters had a different cancer, or is there 2 sisters with cancer, one without? So it's much better to document, as the second bullet point shows, sister 1 with breast cancer and ovarian cancer, sister 2 with colon cancer, sister 3 with no history of cancer. On this slide, I have a few examples that are actually from patients' charts and my chart of some less helpful or useful documentation that we've seen in the chart with more helpful examples. So if you look on the left side, that's where you see the kind of less helpful documentation examples with the most helpful ones on the right side. And looking at the top on both of these sides, the one on the left in the box is a little bit confusing. So the first sentence here states, no family history of ovarian, breast, colon, prostate cancer. And it's possible that some people might read that first sentence and then move on to a different section of the note and not keep reading. If they do keep reading, however, you see conflicting information here, where it says that her family history does include breast cancer in a maternal grandfather and mother, and colon cancer in her paternal grandmother. So not entirely clear if you wouldn't have read through the entire family history documentation. The other thing here is that there isn't any indication of ages of diagnosis, which, as mentioned, that's pretty helpful. So if you look on the right-hand side, this is a much more helpful way to document the family health history in a paragraph format. Not only does the individual who documented this indicate that they assessed family history of cancer in first and second degree relatives, which is helpful that we know who they would have asked about, but also they indicate the cancers that were reported in the family history, breast cancer here, and the maternal grandmother, so side of the family and relationship, and age at diagnosis for all of the relatives. And you can see for the paternal grandmother, the patient didn't know the age of diagnosis, and so that is also noted that it was asked but unknown. Looking at the bottom part on both of these two sets of examples, the example on the left is also a little less clear because we've got cancer listed for mom and unknown type. So it's unclear if the cancer was unknown for the mother or if it was actually a cancer type that was known and reported, and just a less, a more vague term of just cancer was used. For the father, we see both cancer and colon cancer listed here. Same for the maternal uncle, we see cancer and pancreatic cancer. So what we can't tell from here is the cancer, the generic term cancer and colon cancer, the same thing for the father, or did the father have two separate cancers, colon cancer being one of them, and a different cancer type for the other one that's listed as just the generic cancer? The other thing not shown here are any ages of diagnosis. On the right-hand side, however, you can see for each of the individuals who are listed to have a cancer, the specific diagnosis or site of origin of the cancer was used. So colon cancer for the mother, cervical cancer for the sister, stomach cancer for the maternal grandmother, and lung cancer for the maternal uncle. The other thing that's indicated here are ages of diagnosis for those family members, the majority of them. And you can see the maternal grandmother with stomach cancer, you don't see the age of diagnosis over here and the age of onset column. And that's because the patient reported an age that was not exact. And so you can't type 70s into that box. So the individual who documented this used the notes feature to put diagnosed at 70s. And this is a much more helpful thing to look at when we're assessing for suspicion of inherited risk or inherited susceptibility to cancers in a family. And so all of these things are just important things to note when taking a family health history, making sure that you're trying to be as descriptive as possible with relationship to your patient, age of onset, and the specific types of cancers are always the best way to document a family health history of cancer. Thank you.